Thank you, Mr. McGovern. Thank you, Mr. Speaker, Mr. Chairman. I think one of the best ways to protect children is to protect their mothers. And so I rise to speak on H.R. 12, the Women's Health Protection Act, a critical piece of legislation that we should be considering during these increasingly dangerous and tumultuous times for women and their reproductive health care. There's never been a more appropriate time to discuss a woman's right to choose than today. Simply, but most impactfully for our generation, the Women's Health Protection Act will reestablish a nationwide right to abortion in the United States. The WHPA would create a statutory right for healthcare providers to provide abortion care and a right for their patients to receive the care free from bans and restrictions that single out abortion and impede access. It will save lives. Reproductive rights have been constantly at risk since Roe v. Wade became the law of the land almost 50 years ago, but never have they been in jeopardy as much as they are in these current times. In the wake of the decision in Dobbs versus Jackson Women's Health Organization, state restrictions and new limits or bans on abortion fractured women's health care access and dramatically affected the ability of providers to treat pregnancy complications. With the overturning of Roe v. Wade, the Supreme Court has taken away the constitutional right to abortion, leaving millions without access to care due to restrictive and deadly state abortion bans. In my home state of Texas, we have seen horrific cases of women being denied access to care. In fact, Texas is now ranked the second worst state in the nation for women with health issues, according to research conducted by the Commonwealth Fund. The Common Fund developed the first ever state scorecard to track trends in women's health over time and documents how policy choices and judicial decisions may impact women's access to timely health care. The data source includes the Center for Disease Control and evaluated states on 32 metrics, 3 areas: health outcomes, healthcare quality and prevention, and coverage, access, and affordability. Texas ranked last in the country on healthcare coverage, access, and affordability for women, according to the fund. And the number of Texans seeking an abortion out of state more than quadrupled from between 2021 and 2023, after a state law went into effect that bans the procedure in almost all cases. Data from our own Texas Health and Human Services Commission shows at least 7,844 Texas residents received an abortion in a different state in 2023. And up from 4,718 in 2022 and over 1,700 in 2021. Still, the total abortions for Texas residents dropped by 85% compared to 2021. In 2023, just 62 abortions were reported in Texas, all due to medical emergency and or to preserve the health of the mother. Between January of this year and June of 2024, 38 abortions were performed in the state. Every day without congressional action means more people are being denied their human right to abortion. We need federal legislation, and the solution, WHPA, is the solution. We must all continue to work together toward a future where all of us are free to make the personal decisions that shape our lives, our futures, and our families without political interference. And as we know and have seen, those hurt the most by abortion restrictions are those who already face discriminatory barriers to accessing health care, particularly Black, Indigenous, Hispanic, Asian American, and Pacific Islander, and other people of color, women, and those working to make ends meet, especially those in my district. Ensuring access to abortion care is central to the pursuit of reproductive justice and the human rights to maintain bodily autonomy and live in a safe and sustainable communities. For these reasons, I ask my colleagues to defeat the previous question so we can bring up this important legislation. Thank you. I yield back.